Last year we published No More Heroes, our first report on the future of leadership and management, and we did that because it felt to us that there was a lot of criticism of the number of managers and the amount of money spent on management in the service across all political parties. Nobody was really standing up, making the case as to why that investment was worthwhile if we are going to develop the NHS. No More Heroes is about collective leadership and indeed distributed leadership. Leadership, if you will, from the board to the ward. We followed that on this year with the 2012 Leadership Review, which is very much about leadership and engagement for improvement in the NHS. It's about engaging a range of different partners, a range of different stakeholders, and part of it is thinking about what it means to lead across organisational and system boundaries. This is the product of about 9 months' work by various colleagues in the King's Fund and outside. And the bottom line is that there is strong evidence that leaders who engage staff, in particular, are able to deliver better patient experience, stronger financial management, higher staff morale, and there is evidence too of less absenteeism and less stress among the workforce. And you can see that on the next couple of slides, which are taken from our report. Visual representations of, first of all, the link, the correlation between staff absenteeism and the level of engagement that staff expressed through the NHS staff survey. That's where the engagement data come from. And of course, we can argue how far is correlation the same as causation, but this is highly suggestive, we would suggest, about the benefits of staff saying they are really engaged in their organisations, and then the outcome of that judged by just this one metric. And then another visual which illustrates the relationship between staff engagement on the one hand and the annual health check. If you remember the annual health check, we keep on chopping and changing so much, don't we? But this is the forerunner of CQC, Healthcare Commission, I think. It's annual health check on performance, and using the data from that about organisational performance and the data on staff engagement, you see this sort of pattern as well. For us, the business case seems to be compelling, not just in relation to the evidence on staff engagement, but another stream of work looking at the evidence on medical engagement, work that one of our colleagues here, John Clark, contributed in one of the other expert papers, using the medical engagement scale that John and Peter Spurgeon have developed, applying that in a number of organisations in the NHS, and being able to show, again, a correlation between NHS organisations where doctors say they feel really engaged in the work of their organisations and the performance of those organisations. NHS organisations, we are saying in our recommendations, have a major responsibility, and very simple things like effective staff appraisals make a difference. Clear job design makes a difference. Well-structured team environments where there is effective leadership of the team and people know what their roles are and they feel they have a degree of autonomy and control over the work they do, and there is a climate that supports staff to do what they were trained to do. We think NHS boards have a particular responsibility here too. To take serious notice of the results of the staff surveys. I said I'd come back briefly to talk about leading not just organisations or institutions, but what we feel here at the Fund is increasingly important, leading across boundaries, across organisations, leadership across systems of care. The reason we think that's important is the NHS in the future needs to be much more focused on how we can overcome fragmentation. And from our point of view, if you look at the evidence, the drivers of change, the ageing population, the increasing burden of chronic disease, it seems obvious that we need much more joined up integrated care, overcoming those divisions and delivering care that's really coordinated around the needs of patients and service users. And that requires a different style of leadership. It needs chief executives, leadership teams and boards willing to reach out, willing to work in partnership across those organisational and system boundaries. And the challenge that presents is that we haven't really created a system in the NHS that incentivises good working across organisational and system boundaries. We need people who have the vision and the commitment to overcome the barriers. Some of you may have been through the top leaders assessment, the use of the Hay profiling approach to look at styles of leadership among top leaders. What that shows, as we know, is that the pace-setting style is the predominant one alongside others, and there are good reasons why that seems to be the case. We've come out of a decade or so of strong performance management. If we're serious about integrated care and engaging staff and patients and other stakeholders, then that needs to be complemented by other approaches. Implications, let me bring this down to a more local level. Work that we've reflected in our report from Jill Mabon and colleagues at King's College, work which shows the value of team leaders working on wards, working in the community, working in other health and social care settings, in creating the right climate for delivering high quality patient-centred care. Leadership development programmes ought to bring together leaders from different professions and organisations, not just within the health service but between the NHS and social care and other sectors too. And then of course the Commissioning Board and the Leadership Academy have an important role then in modelling and supporting the kind of leadership and leadership development the NHS needs in future. There's too much variability across the NHS. There is work to do. We have some very good examples of organisations that do these things and do them well, but we need more to be in that camp, and we hope our report will be a small contribution in supporting further development in that direction. Thank you.